why don't we go ahead and get started, and we'll just start with introductions. So thanks for joining us for our virtual Senior Circle meeting. I appreciate it, and apologies if you had any trouble getting the link. We're sending out an updated link, so hopefully we'll get some more attendees. While we wait, why don't we go around and just give a quick, your name and the organization or community that you represent. That would be great, so everyone knows who's here. And I will just kind of start based on how everybody appears in my screen. So Amanda, I'll start with you.
Great, thanks. My name is Amanda Varga. For those who don't know me, I am the community liaison for Orion Mortgage. My job is mostly focused on education around reverse mortgages. And then I'm also the owner of CareTracks, which is focused on helping to support, train, and guide family caregivers of aging loved ones.
Great, thanks Amanda. Tracy, want to just give a quick hello?
Hi, I'm Tracy Ott, and I am with the Arapahoe County Adult Protective Services, and I am the mastery caseworker there and one of the presenters today.
Thank you, Tracy. Mandy?
I was doing a side Google for Aurora evictions, and then my window disappeared. Mandy Ashley, the executive director of the Aurora Health Alliance.
All right, thank you. And Alice?
I'm Anna Mary Corvista with Benefits in Action. I guess y'all know what Benefits in Action is, right? Okay.
Yeah, and there'll be time at the end after presentations to kind of tell us a little more, tell us what's going on, events, things like that. So yeah, thanks, Alice. Krista?
Your mouse always stops working right when you need it.
Yeah.
To, right?
Yep. That's the rule with virtual meetings.
Hi, everyone. I'm Krista Keller, and I'm with United Healthcare Medicare Solutions. And I also am the Vice President for the Arapahoe County Council on Aging.
Great. Thanks, Krista. Rich?
Hi, everyone. Rich McLean, and I'm on the Aurora Health Alliance board.
Thanks, Rich. Rosalyn?
Hello, thank you. Rosalyn Reese, Director of Diversity and Inclusion with the Alzheimer's Association Colorado chapter, and I'll be sharing just a bit of what we're doing. Thank you.
Great. Thanks, Rosalyn. Hi, Pat. Want to go next?
Okay, I hate getting off and on mute.
I know.
Now I'm Pat Cook with the Colorado Gerontological Society, and we've got quite a bit going on since COVID hit the fan. But at any rate, one of my biggest pain in the asses right now is the number of evictions that is going on all over the metro area.
Yeah, for sure. Thanks, Pat. Bonnie?
Yeah, I'm Bonnie DeHart, and I'm on the Aurora Health Alliance board as well.
Thanks, Bonnie.
Mm-hmm.
Courtney?
Sorry, my mouse was on a different screen.
It's okay.
Eric, I am new to the Arapahoe County Community Resources Department, and so I am the grants coordinator assisting with senior resources, housing, rent assistance. I do have a little bit of information. We talked about it last week about the CDC issued a moratorium on evictions. I'm not sure if anybody's seen that, but you have to earn less than $99,000 and you have to actively be applying for support to or like rental assistance and prove that you are applying. And there's more information if you just go to cdc.gov. I'm not an expert in any way, but just if you have questions, specifically the city of Aurora, I'm not sure what they're doing. I know they have assistance, but that I just wanted to share that as well.
No, that's great. Thank you, Courtney. If you are able to sometime this hour or so, if you find that link, you can throw it in the chat if that's something you want to do. That'd be great. Yeah, thank you. Thanks everyone for having your cameras on too. This is probably one of the first meetings I've ever been in where I see majority of people, which is really nice. All All right, so we're going to start off with Rosalyn Reese. And Rosalyn, we can stay like this until you want me to put up that form that you sent me. So you let me know how you want to work that, and I'll let you go ahead and introduce yourself and go for it.
Thank you, Joe. I appreciate you having me and AHA, and it's good to see some of you I know, and to meet others of you. It's been a while since I've attended your meetings, so I really appreciate the opportunity. Again, Rosalyn Reese, Director of Diversity and Inclusion with the Alzheimer's Association, and I have oversight of our D&I, as in short, Diversity and Inclusion, for the purpose of achieving health equity in all communities. And as well, I have oversight of volunteer management, our community engagement, and our education and support. So I wanted to take this time that Joe allotted me to pretty much just make it conversational and letting you know what we're doing. And in light of post-COVID, we've been working remotely since March, and I'm sure like most of you. And so recognizing that first and foremost, Alzheimer's disease is a public health crisis, and over 5 million people are living with the disease in the United States, and in Colorado, 76,000. I'm sure you with your agencies have heard some of these alarming statistics. And we recognize that there's a need to serve or to be more intentional about serving underserved communities, if you will. So just to give you some context, we have updated our vision and mission just slightly. So our vision is a world without Alzheimer's and all other dementias. Oh, I apologize here. And our mission, in fact, is to lead the way in Alzheimer's research and reduce the risk of dementia through the promotion of brain health, as well as early detection. So what we've been doing here thus in this post-COVID time is we recognize that as meeting people where they are, as far as community engagement is concerned, we needed to shift our priorities. So one of my priorities is in fact Arapahoe County, in which I am your point of contact for all things programs and services in Arapahoe County. And then we have a team member who works specifically with the other counties in Denver Metro County. And actually, just to put it out there to all of you, since you represent organizations, we will have a posting soon for a bilingual community education manager or a community engagement manager. We just slightly changed that position, in which we will need someone who speaks Spanish to help us reach the Latinx community. So as far as what those statistics look like in underserved communities, and all of you know that Alzheimer's disease is a progressive brain disease that destroys brain cells, and the fact that it stages over a period of time. So I know I don't want to inform you with information that you don't already know. And you know that dementia is an umbrella term that describes the decline in memory, thinking, and behavior. Well, the fact is, we know that there are communities that are impacted by Alzheimer's greater than others. For example, African Americans are 2 times more likely to be diagnosed with the disease. Latinos, 1.5 times more likely. And other racial ethnic groups have higher disparities for a number of reasons. As far as Alzheimer's, age is the primary risk factor. So the older we are, or the longer one lives, the higher the risks, in fact, are. So given that, that's across the board, that impacts all of us. Other risk factors is the fact that women have a greater risk because women are living longer. And I mentioned African Americans, twice as likely. Latinos, 1.5 times more likely. So with that, we recognize that the social determinants of health actually play or have a role in this disparity, if you will. And Joe, you can go ahead and share the screen or the document that we crafted during COVID, during this period, because we recognize that COVID has exposed a number of health disparities. Thank you, Joe. So in essence, let me ask Joe, will you be able to share this with everybody afterwards? Okay, thank you. So I don't want to go over the entire document, but in essence, you'll see that COVID-19 has further exposed the health differences between racial and ethnic groups based on social economics and the lack of access to health care. Black Americans are 2 to 3 times more likely, as this document indicates, than whites, and 1.5 times more likely for Hispanics. And I know I've said that a couple of times, but I think it's important when we look at, as organizations, we look at the fact that hopefully our goal is to achieve health equity for all people, which essentially is that, the assurance of making sure that everyone has access to health care. Health determinants range from food deserts to socioeconomics to environmental factors, you name it. So we know that systemic inequities actually play a role in how someone is able to access care. There we go, thank you. So there's also reference to housing and the fact too that on the front line, you may have a situation where more people of color are working the front line and more exposed to health conditions, or in fact, if there are underlying conditions that a person has. And with the detriment of COVID, the risks are even greater. So how does that play into dementia? Well, COVID is, as we know, a horrible infectious disease. And the fact that if someone has a diagnosis or underlying conditions, it may put them more at risk. So we're focused on educating caregivers how to successfully care for someone who may have dementia, any form of dementia, and in this COVID time period. What we've also crafted is a presentation called COVID in Caregiving that actually outlines some tips for folks. So fast forward on this document, it just simply gives you some language, if you will, and work circumstances and data in terms of how people of color are impacted. As far as insurance, access to insurance, affordable health care, you're able to see what those numbers look like, and the fact that stigma and systemic inequalities undermine prevention efforts. So we've created a COVID-19 help center to offer tips for families and caregivers. And I've already mentioned the presentation that we offer. We've converted all of our programs and services to virtual. We have online support groups, and we have virtual community education classes that folks can register for, and all of those, of course, are free. So I wanted to just simply share this and hope that you would be willing to pass this information on to your constituents. And I'm happy to take any questions if I have time. Thank you.
Thank you so much, Rosalyn. We do have time for questions. So could you tell us a little bit more about the COVID and caregiving? You said it's a presentation?
Uh-huh. Yes, it's a 1-hour presentation. We talk about the fact that some families have their loved ones in long-term care communities and how to interface or interact with the staff. You know, we just essentially say how they can, things they can ask for, tips as far as ensuring that the staff is providing access and good care for, you know, the persons they're caring for. What else? It's been a bit since I've actually presented the presentation. But we give the information, the comparison on long-term care or if someone is in the home, what they can do and how to be safe.
Gotcha. Thank you.
Mm-hmm. And on a policy level too, Joan, we're doing some things from a public policy perspective. And that's information, if there's interest in that, I can share with the group later.
Yes, I think that'd be great to know. We're always kind of interested in the bigger picture of things and what's being done legislatively. So yeah, you can give us an overview now if you want, or throw stuff in the chat, or we can talk about it after, whatever.
Sorry about the phone.
Or you can get that phone call.
Turn this off. No, I have way too much stuff going on. Also having work done around the house. So yeah, no, I don't have those details at hand. So I'd love to get those back to you to email that and you can feel free to share it.
Sure. We did have one question come in. What can community organizations do to support the work in regard to this inequity and health disparities?
Yeah, that's great. Great question. Thank you for that. Well, first and foremost, by asking the question, it tells me the organization values diversity and inclusion, and that's the first step. And you know, looking at your internal systems, if you will, to see how you actually interact or go about interacting with communities who are underserved and who may not necessarily come to you for your services. So that's the first thing. And then educating yourself about the different cultural differences that may, you know, exist or in fact exist in various cultures, but to take the time to educate yourself and or refer constituents to organizations like ours who take the time to ensure that we are culturally sensitive. And I think it just starts there. You know, if there's a need for a conversation to see how we can, or even how I can help inform, I'm happy to set up virtual conversation. We're doing everything virtually as well as presenting to virtual audiences.
Great.
Mm-hmm.
I want to give an opportunity for, I have other questions I could ask, but I want to allow others to pipe in with any questions or comments or thoughts about what Rosalyn shared?
Is there a fund for respite care for families who do not have respite care? Well, you know what? I know that we partner with like Easter Seals and the Woodard Group. I'm not saying the name right, but there are some agencies out there that provide respite care. Our 24/7 helpline, the 800-272-3900, would be better equipped to kind of give some context on where that respite care is.
I can throw in some info that the Easter Seals program, the Colorado Respite Coalition, is really great. We actually use it in our home for respite care, and it's a fairly easy application process, or at least it was a couple of years ago. And then when we were involved, it was $1,000 per family. And then there was a list of locations or providers who were approved to accept those funds. So you don't have as much choice as to where to have respite, but you can have it on site somewhere else, or you can bring it in your home. And it's an incredible option for family caregivers who need a break. So
excellent. Thanks for that.
Financial restrictions, as far as I remember, it was just that you are providing so many hours of care per week to a family member. So great organization.
Yes, thank you.
Thanks, Amanda. Is it going on right now? Pat, do you mean the Easter Seals, the respite? Yeah, Amanda, do you know if they're still, or does anyone know if they're currently doing respite in home? I mean, I imagine it's a challenge now.
I'm not 100% sure. I can certainly find the latest email from them and put that email information in here for someone to ask the questions, because I believe that those respite funds could then be channeled through some of the home care agencies who would then, provide care in your home. And so it's probably a matter of whether or not the approved home care agencies are, doing that. And I would assume that they are. That most home care agencies are full bore working now. If you have someone who's COVID positive and you need respite care, that may be a different situation. But all the precautions will be in place as far as I know. But I'll find the contact while we're sitting chatting here, and I'll throw that in chat.
Okay, thanks, Amanda. I think it's really interesting because I think it brings up a really interesting kind of delicate situation we're in, where you've got individuals who are in a high-risk category because of age or other health conditions, but then you add on situations such as, for example, our situation where I have an in-law who has Alzheimer's, and so we're trying to keep that person isolated as much as possible, but at the same time, that means they're not getting the socialization and getting out of the house and doing all the things that would be good for them to be doing. But it's like this balance of people need respite, people need in-home care, people need to be continuing to work their brains and get out and go to those fitness classes and things like that. But at the same time, if they're in a high-risk category, we really don't want them going out too much and potentially being exposed to coronavirus. So.
Absolutely, Joe. I have another document I'll share with you. We have early stage programming, and we just converted that virtually the last few weeks. So it's an opportunity to engage with, other partners who participate in cultural programs, and they're geared toward early stage families. And so it may or may not be appropriate, but I believe there's some music. It's part of the Spark curriculum. There's music programming. It's a number of things that might be helpful.
Great. Yeah, send along anything. And then when we send out our next Senior Circle email, we'll put all the information and resources and everything in there that we can. We'll even include the Easter Seals respite info and stuff like that. Thanks, Amanda, for putting that in the chat.
Great. Thank you.
Thanks, Rosalyn, so much. Really appreciate your time.
Appreciate you.
All right. So next up we have Tracy Opp, and Tracy, I can go ahead and share my screen if you want with your PowerPoint. If that works for you. Okay, let me just.
Yep, that'd be great.
Close out Anything else I have here? We go.
I try really hard to keep my eye on the time as well. The
No
presentations
worries.
usually are a little bit longer, so I'm going to do my best to just really sum it up. That's why the PowerPoints are going to keep me on track. And maybe I
Gotcha.
can come back at a later time and, you know, present more.
All right, so I hope that this is working properly. There. Does that look right, everyone? Thumbs up? No? Yes, no?
We see the full slide deck. We can see the next slide as well.
Just okay if you want to just go to that next slide.
Yeah, but how do I get it off then?
I've had to end the share, and then when you go to reshare it, it's a different selection.
Sorry, y'all. This is only my second time doing a share with a PowerPoint.
Slideshow
like
up
this
at the
unless
top.
other people do, but.
Do you see the slideshow up at the top? Then from the beginning, yeah, right there. Oh, you did that.
Yeah. Well, that's right. Just don't look at the next slide.
The window for your viewing people in that corner will be fine.
Yeah, that's right. Put your window down to speaker view.
So again, my name is Tracy Opp, and I'm one of the adult protection caseworkers with Arapahoe County, and I've been there since 2007, so 13 years actually this month. The role that we have, and so this is, you know, obviously every county, we all have the same rules and statute, but it just might look a little differently. So I can't speak regarding other counties unless it's really specific to rules and statute, but their processes could be different. And actually I know in some things they are different. The role of us as adult protective services is that first and foremost, we investigate the alleged allegations. We also perform a very intense needs and risk assessment where we go over all of their activities of daily living and instrumental activities of daily living, which is that on the slide, the cognition, the behavior, the medical, the home residence, the financial, and other mistreatment that may or may not be occurring. Oftentimes individuals call in reports for specific mistreatment that they think is occurring, but aren't aware of other possible mistreatment. So in our assessment, although we're there for one reason to investigate, we are asking about potential other mistreatments that could be occurring currently or even past mistreatment. If they were part of any sort of past mistreatment, and if at the time were they an at-risk adult. So we're assessing that as well, which a lot of community individuals aren't aware that we are doing that assessment. We are doing case findings on all of our allegations. Letters are being sent out for those allegations that are substantiated. And that came into effect about 2 years ago with the Senate bill, where now all licensed care facilities, home health agencies, hospitals have to do this CAPS check. It's different than a CBI report, but if they find that a prospective employee or somebody currently working for them, if they do them periodically, it would come up if there was mistreatment of an at-risk adult and they were named as the alleged perpetrator. We also then are doing case planning with our individuals. So even though we've completed the investigation and assessment, we may stay involved if there's some risks that need to be mitigated. So we are case planning with the individual themselves if they are able to participate, or with their home care provider, family member, court-appointed guardian, or conservator if appropriate. At times, we also have to do involuntary case planning due to the individual's level of cognitive impairment. And I just put in there other duties as needed because yes, we have specific role and duties, but we are also available as needed to provide ongoing resources. If a case is not necessarily open, I've been working at Arapahoe County a very long time, so individuals will call me. We are, we're available to offer services, resources to those that living in the community. You can go to the next. Figured we'd save questions till the end. That way I know I get through my presentation. One of the other areas is that people, and you may wonder, what happens to your report? If any of you have ever called in a report, like what happens to that? Every work day, the reports received the day prior to are reviewed by some of us in the APS team. We have specific days that we are assigned, and we read the reports. We read them, we do some history. If we've had history with the individual before, if there's some criminal history, so we look into courts, we look into trails, which is the child protection system, because we do work with individuals 18 years of age and older. So there are some that also have a child protection history, which can be pertinent for us to know that information. So decisions are made on whether or not a case is screened out, screened in, which means that it's assigned to a worker, or sent to prevention. Prevention is specifically with Arapahoe County, unlike other counties that do not have prevention. So we're very lucky that way. The two things that we are always looking for when we are reading the report and making case decision is, first and foremost, do we have an at-risk adult? And then, is there mistreatment occurring? So there has to be those two things. The individual must be an at-risk adult, and there must be mistreatment occurring. Next slide. So for your knowledge, the criteria, as I spoke about, you have to be the individual has to be an at-risk adult. Well, what's the definition of an at-risk adult? Because it's very, I don't want to say it's very different, but it's different than the mandate of what an at-risk elder and an at-risk individual with IDD is. An at-risk adult means an individual 18 years of age or older who is susceptible to mistreatment because they are unable to perform or obtain necessary services for their health, safety, and welfare, or lacks sufficient understanding or capacity. So that's where we're into those cognitive deficits. Some, it's not just Alzheimer's dementia, it could be TBI, it could be IDD. Lacks that sufficient understanding or capacity to make or communicate reasonable decisions concerning their personal affairs. And if they meet that criteria, then the next step is there mistreatment happening? In the mistreatment categories that we investigate, and in this particular PowerPoint, I don't go over specifically the definition of each. We investigate abuse, which is physical abuse and sexual. We investigate exploitation, financial and non-financial exploitation, caretaker neglect, and our most high percentage-wise, self-neglect. Next slide. When reporting to APS for Arapahoe County, and I did on this slide put the phone number to our crisis intake, and this is definitely a PowerPoint that Joe could share with the team if that's something that everybody wants. But our crisis intake line for CPS as well as APS is listed under bullet point 1, the little of the phone number you would call to make a report. Very important when you're calling to make a report is be prepared. So make sure you have the individual's name, their address, phone number. If you have their date of birth, that's great. It helps us when we are doing those history checks that I mentioned in a few slides prior to. And the current circumstance, like what caused you on this day to call in? What are your concerns? Did you see something with your own eyes, or did somebody tell you something? You know, what brought you to make this call? What are the circumstances that are concerning to you regarding this individual? It's not your job to figure out whether or not what you're concerned about is actually happening. That's for us. Just call it in. Express your concerns and your worries. If there's an alleged perpetrator who is causing the mistreatment, if you know their name and their address and their date of birth, if you don't, it's okay. But the more information that you have at the time of the call, the better chances that we are getting the best information. We can make the most reliable decision when deciding, are we going to assign this case, screen it out, send it to prevention? You know, and any additional information that you might have about that individual, if you know that they go to a medical doctor, the name, or, you know, if there's another support person that you know is in their life, providing that information as well. Our screeners have very specific enhanced questions that they will ask you as the caller, so it'll prompt you, but it's always good to know a little bit ahead of time, I think, of what they are going to be asking you about, to make sure you have that information, if you have it. And then Joe had asked if I could just talk a little bit about if we've seen trends since the pandemic, you know, if we have or haven't. And so obviously what we've seen, which was talked about, you know, is our individuals are isolated. They become even more isolated because individuals who are going to possibly adult day programs, or our IDD population that were going to work on a daily basis, socialization that has decreased. For a while, home health agencies were not going into the homes because it was so unknown at the beginning. And a lot of home health agencies didn't even have the appropriate precautions to provide their staff to go into the homes. Arapahoe County didn't. We were going into homes and we're providing our own hand, you know, masks and stuff. And we've definitely seen the caregiver burnout, because those individuals who were being cared by somebody, those individuals were maybe going to a day program during the day or to work, or maybe they also had somebody coming in. That has stopped for some and has not been reinstated since March. People are not returning back to day programs. They're not going back to work programs. Those have not been reinstated. Majority of home health agencies are back in, but we've seen a higher caregiver burnout. And then how does that look? It comes across as potential physical abuse and caretaker neglect is occurring. So that's been a definite trend. You know, I'm not probably sharing anything that is shocking to any of you. Mental health issues, depression, anxiety, a sense of loss, you know, reduced socialization. Reports were less at the beginning of all this, but I think it's just because people didn't know what to do and what was going on, but that has been no longer. And we are getting more reports actually, I don't want to say than ever, but we are definitely at a higher number of reports being called in, and appropriate ones, and being assigned. Real quick, an example, I mean, we are getting a lot of reports for nursing home caretaker neglect. Staffing numbers are down, people aren't showing up, somebody's getting COVID and reporting it and they can't fill that position quick enough. And we do take that into consideration when we're doing our findings, because it has impacted the level of care that is being provided. So that was a lot. Questions, thoughts?
I have a question, Tracy. How does the work that you do overlap or connect with an ombudsman, and what the ombudsman does, which probably everyone here knows what an ombudsman is, but it's someone who helps kind of mediate and represent a resident of a long-term care community if there's some sort of complaint about care or whatnot. How does that connect with what you do at APS?
It doesn't connect very well because ombudsmen have a different role in confidentiality. where they are an advocate for the client 100%, which is fantastic. Their role is not to investigate allegations of mistreatment. Obviously, if a client has a complaint about a facility, they look into that, but it's not in an investigative manner. They don't have the same federal mandate that we do to investigate, interview the client, interview the alleged perpetrator. They're not doing that type of interviews. And they actually are not able to share information with us. So even when, because we take on guardianships in Arapahoe County, I have 6 individuals. And I've had more throughout the years, but I have the same lady that I've had the whole 13 years I've been working with Arapahoe County. And she had an ombudsman once involved, and I didn't even know it as the guardian because their rules are different. They didn't even have to notify me as the court-appointed guardian of this individual. And nor when I reached out to them would they even have a conversation with me. So their role is very, very different than the role of an adult protective service worker.
So you wouldn't even know if there are certain things going on. Those might not even reach
Correct.
the point. It's not like you'd be investigating something that then they're also investigating the same kind of, okay.
Yeah. No, we'll do collaborative investigations with our CCB organizations, you know, Developmental Pathways, Rocky Mountain Human Services, and then obviously we do collaborative investigations with law enforcement. The ombudsmen are not one of them. So completely different roles.
Okay. Thanks for that. Other questions for Tracy? No questions. No one.
Well, thank you for your time. Joe has my email. I didn't provide it, but if anybody has any questions or thoughts or contact information, you can always reach out.
Yeah, and thank you for letting us share your PowerPoint. We'll put that in our next email blast for Senior Circle. So yeah, thank you. Thanks, Tracy.
Yes.
I just wanted to say thanks to Tracy and APS. I know we use APS a lot, so you all have been an amazing community partner, so thank you.
Well, you are welcome, and I ditto that because we, especially with my individuals with Alzheimer's dementia, we give them your information, and resources have been so helpful to them when they do access them. So to have that as a resource is amazing.
Awesome, thank you. Well, thank you both, Tracy and Rosalyn, for your information. It's really valuable and appreciated. We're going to take kind of the last 15, 20 minutes, however long, to kind of let you all let us know of events or things happening. I have a few events on my end, but I'll kind of let you take it from here and just let us know what's going on in your world.
Joe, Pat has a question for Tracy.
Tracy, is the department working with Larimer County proposal?
I'm not sure what proposal you're referring to. If you're referring to the DR, which actually started in Arapahoe County, but Larimer is part of it. I'm not, what proposal specifically?
I think she's typing. Pat, I think you're typing. All right, well, we'll get a little more clarification, the DHS board meeting.
That'd be great. Yeah, I would need more clarification. I mean, we did, a new statute just was approved, and that will go into effect on Sunday, where we will be investigating a new area of mistreatment. But that started at the state level, not through Larimer. So I just would need a little bit more information.
Yeah, we'll just kind of keep an eye on that. Yeah, anybody have announcements, events, things going on? Amanda, you've always got some good stuff going on.
Always got announcements. And I do. So we have a reverse mortgage seminar coming up next Monday from 1 to 2. It's going to be online. We used to do them in person, not so much anymore. And this is really our Reverse Mortgage 101. It's meant to really speak to individuals and families and professionals who either don't have a good grasp of what they are or have maybe an incorrect grasp of what they think they are and why they don't promote them to their clients, and why there's trepidation there. And this is really meant to help dispel that, because what a lot of people don't realize is we've done reverse mortgages for people already on Medicaid to help them stay in their homes, change their financial situation, and yet keep them under the threshold so they maintain their benefits. And we've done reverse mortgages for multimillionaires whose financial planners said this is the most cost-effective way for you to access money, and everyone in between. So this really goes through what they are, who qualifies, and then a variety of different ways we've used them with clients. So it's a lot of client stories. And typically people leave this going, wow, I had no idea. That's not what I thought they were. Why doesn't everyone have one of these? And they're not for everyone, but it's just good information to have, so we make sure people are making financial decisions after looking at all of their options and deciding if it's right for them or not. So Monday from 1 to 2, and I will put the link in for the Orion Mortgage events page. There's a link to the Zoom. There's no password. You can just come on in and join us, and we'd love to have any of you. Thanks.
Thanks, Amanda. I do want to announce that the Arapahoe County Council on Aging meeting, which is virtual, the next meeting is coming up on September 28th. So if you can join us, I think, Krista, is it at 1 o'clock? I know that's usually our buyer's luncheon, but since we're doing it virtually.
Yeah, it's from 1 to 2, and feel free to email me. I can put my email, or Joe, we can send you guys the Zoom link, and it'll be a really cool panel. We've done a couple panels this year, but the next one will be all of the rec centers in Arapahoe County and what services are available right now with the COVID situation. So it'll be kind of fun to see their creative ways of still keeping people active and involved.
Great, thanks, Krista. So again, that's September 28th. It's a Monday, 1 o'clock. It's virtual. Just like Senior Circle, our meetings are virtual through the end of the year and probably through next year too, I'm thinking. So I want to keep everyone safe. So, which hopefully gives people more flexibility to attend more meetings because you're not driving in traffic. I did want to announce so one of the things I wanted to just mention is that as we kind of look towards 2021, Senior Circle is really trying to start incorporating a little bit more information and topics that involve the current research going on in the senior field, legislation that's coming up, and looking at maybe doing panel discussions about social determinants of health and how those affect individuals as they age. So if you have ideas and thoughts, let me know. There is what I assume will be a great event coming up on September 17th, which is next week, Thursday, September 17th, that is called Practical Approaches to Race-Based Stress and Trauma in Older Adults. It's an hour and a half, and it is, I believe it's a VA hosted event. And so that's kind of, I think that'll be a really great presentation. So that's coming up next week. But, like I said, as we look forward to the next year coming up, we really want to start kind of incorporating, the social determinants of health and just all different kinds of pieces to kind of really look forward at what's happening in aging. I think the coronavirus has really brought up a lot of interesting conversation around ageism and what that looks like and how that plays out. So, again, if you have thoughts, I'll be going to a lot of different webinars and seminars and things and pulling information and speakers and stuff, but we're really looking to kind of make a more robust Senior Circle presentations and stuff. So you can always feel free to email me about that. Yeah, any other announcements, thoughts, comments? Alice, go for it.
Hi, I just wanted to announce that on October the 3rd, we're having Volunteer Service Day. We deliver food to like 300 people a week, and we really have a list of like 500 people, but we don't have enough drivers. And so we're doing this Saturday, October 3rd, volunteer service day, trying to get 30 or 50 drivers so we can deliver food to everyone. And we're going to meet at our office at 9:30, and everybody will drive their own car, and they'll just deliver food to the doorstep. So it's going to be safe and everything. So the more you can advertise it, or the more the word gets out, the more people we can get to get these hungry people fed. So
Alice, could you tell us, remind us again who you're with?
Benefits in Action.
Okay, and then will you put your email and everything in the chat box for us, and then I can get that in our email blast. Yeah, definitely. Thank you. October 3rd, which is really not that far away. So that is a Saturday. Yeah, 3-4 weeks. I'll be here in a second.
If I have your email, I could email you the flyer. I mean, I have a flyer.
That'd be great.
Okay.
Yes, I will put my email.
Thank you. I'm glad I got to come today. Thank you.
Me too. Thanks for coming. Yeah, we're always happy to get out volunteer opportunities, especially ones that are, feel safe to people. And that sounds like a great opportunity. So yay. Hopefully it won't be snowing that day. You never know. All right. Any other announcements, questions?
Hi, me again. Just wanted to let everyone know that the annual enrollment period for Medicare is coming up quickly. That's always every October 15th through December 7th. So obviously that'll look a little bit differently this year, as is everything. And I'll be hosting a series of virtual meetings, which is really great. It's just basically a Medicare 101. So we explain what A, B, C, and D all mean, time frame of everything, and just, some options as far as, what an individual might need. So I have my email just posted for the Arapahoe County Council on Aging, but I would love to send that information out to anybody who might be interested to pass along to their clients, and they can just attend, just like what we're doing today, a Zoom meeting. And I just do kind of a Medicare 101 and try to make it as fun as possible.
Awesome. Thank you. Thank you. It's always good to get a refresher on that, honestly. And then Rosalyn, I see that you posted that the Walk to End Alzheimer's is on September 19th. And you are walking, yeah.
Yes, we are not walking in City Park, of course. However, we're walking in our neighborhoods. We will have a virtual platform, which is an interactive platform where folks can access resources online, and then afterwards walk with their neighbors, friends, family, golf, hike, whatever it is you'd like to do. So we're being creative this year, and anyone interested can go to our website at alz.org/walk or email me. Thank you.
Perfect. Thank you.
And then I have a couple things.
All right, Rich.
Okay. In the city and throughout the country, we've had a lot of turmoil focused on, the need to address racism, the problems that our country has faced in racism. And we've noticed, and of course, we've had lots of turmoil in Aurora because of Elijah McClain. A group of ministers are getting together, and they're inviting all the community to come this Sunday. This Sunday should be a nice day, 4 o'clock, to gather at the Aurora Municipal Building, the one there on Alameda next to the library. And it's kind of a prayer type of thing, but it's a peace thing to express that Christians, in the true sense of Christianity, love your neighbor, love our neighbors, and care for our neighbors. And it's not there to make any type of statement on what should be done about the police. It's just to bring community together in a spirit of love and caring and kindness and unity. So come, it'll be peaceful. Ought to be a nice afternoon just to show your support for community, for the feelings of hurt that families are going through. It won't be a political, there'll be no politics involved. We will not have political speakers get up. but it will be a chance for community to come together and kind of a vigil type of thing, only be about an hour. 4 o'clock then at the municipal building. The second thing is Aurora has had its mobile food pantry all summer, once a week. We're going now, I say we, I'm not part of the city of Aurora, but I'm supporting them. We're going to a once a month Aurora Day of Giving. The next one, or the first one, will be Saturday the 26th. Yes, Saturday the 26th, basically at 10 o'clock, and need volunteers. We expect to have 1,500 families coming through 4 lines of traffic at, gosh, which high school is it now?
Is that the one at Hinckley?
It's not going to be at Hinckley.
No.
It'll be either Overland or Gateway. Let me just look real quick. That'll be the first one. Let me just make sure I give you the right information before I go on.
And you can email it to us, Rich. And put it.
It'll be Gateway the 26th at 10 a.m. And obviously we need lots of volunteers. So if you guys can want to volunteer or have a circle of folks that maybe want to step up and help families. And these are desperate times for people, and it's not getting any better. Then come on out. This first one will be September 26th at 10 o'clock at Gateway. And looking to have you come out and support these families that will be coming through the lines. And those are my 2 announcements.
Hey, Rich, this is Rosalyn. Thank you for that. Thank you for both announcements. Regarding the volunteering, will you have shifts or just whatever length of time?
It's, it'll probably go 3 or 4 hours. The thing, there's, as far as I know, and of course this is just starting, we don't have shifts like, some people come at 9 to kind of set things up. Some people come at 10 or 11. We may graduate into that. But for September 26th, show up as soon as you can, close to 10 o'clock. If you can coordinate with the city, you would coordinate with Joshua Nicholas, who works with community engagement. You can find his email or connect with me for his email. You can do that and let him know you'll be there, or just show up. And we'll find things for you to do. There's plenty to do. Ought to be kind of a fun thing too. As long as it's not going to be a day like this morning. That won't be.
Hopefully not. Great. Thanks, Rich. Thank you for that. Keeping us up to date on community things happening. Any other announcements? There's a lot of good stuff going on, and it's exciting to hear. All right. Well, thanks everyone for joining us. Again, thank you to Rosalyn and Tracy for being here. Thank you all for spending the time. And again, if other things come up, let us know. Otherwise, stay safe, stay warm, and we'll see you hopefully November 18th for our next Senior Circle meeting.